Howdy, howdy, y'all. Dr. Shawn Tassone, America's Holistic Gynecologist, and this is Confessions of a Male Gynecologist, wanting to address a topic today that is, I guess I take it for granted, but overall, I probably shouldn't. And that is the topic of menopause. I don't know if I've specifically done something on just menopause, and it triggered me because I've talked about this in other podcasts about the celebrities that are out there kind of talking about it. They've kind of gotten into their 50s, women like Halle Berry. And while it's great that they're out there bringing awareness and talking about things, sometimes they get the information a little bit wrong. And then they're schlepping their own products and supplements that I've talked about, how they basically kind of they've solved the problem of menopause once and for all. They've solved it. And the amazing thing is, if you just take their supplement, well, you'll be delicious and you'll have all kinds of friends and basically that whole 9 yards. So what I wanted to do was talk about the 10 basically commonly asked questions about menopause and kind of make it just an easy, open-ended discussion, because I still think that even though menopause has been around as long as there has been females in this world, it is really only garnered attention just recently. And it's really sad because obviously women have been suffering. I remember when I started my journey in 1998 as an OBGYN in residency, and I remember, oh my God, that is a long time ago, almost 30 years ago. But anyways, I asked my grandmother, I said, hey, do you remember menopause? And now this is a World War II mom. She, had to go to work when my grandfather went to war to make money for her family, and they made ammunitions basically. And she said to me, she looked at me like I was kind of an idiot, and she said, what the hell is menopause? So, not that women today are different, but the culture is different. And I think women back then were just made to suffer. And so they did, and they suffered in silence. So, number one, what is menopause? Well, medicine, in our typical misogynistic fashion, we have defined it as the point in a woman's life when she hasn't had any menstrual cycles or bleeding or spotting for 12 months. This, to me, is totally ridiculous, because obviously you go into menopause before you've hit that 12 month. I mean, you've been in menopause then for 12 months, because if you haven't had a cycle for 12 months, that means your ovaries stopped. And when the ovaries stop, they stop making estrogen and progesterone, which is interesting because Halle Berry forgot to mention that 50% of your body's testosterone also decreases. So again, we're not getting the message out there about testosterone. And I think that with testosterone being the number one circulating hormone in a woman's body throughout her reproductive life, to then not mention it in the menopause discussion, to me is a heresy. It's ridiculous. But anyways, in medicine, we describe it as no periods for 12 months. Now, obviously, there are different ways to diagnose menopause. There are two hormones that are made in your pituitary gland called follicle stimulating hormone and luteinizing hormone. Now, these two hormones are made to cycle. They cause you to cycle. FSH and LH control the ovaries. Now, what happens is when both of those hormones are over basically 40 on a lab test, and you're not having periods and you're having symptoms of menopause, which we'll talk about, that's menopause. You don't have to wait 12 months. And the fact that we even say that to women, to me, is a disgrace. You have to suffer for 12 months before we'll even consider giving you hormones. So you can wait for 12 months and meet the diagnosis, or you can get your blood drawn. Now, I know my colleagues are going to say to you, well, why do we draw blood? Because the hormones fluctuate all the time. Well, that's stupid, because in menopause, they don't. In menopause, your hormones don't fluctuate. They pretty much stay in the basement. So it's easy to diagnose an FSH and LH over 40 and no periods and symptoms of menopause. So, number 2, what age does menopause start in most women? The average age of menopause in this country or in the world is basically 51 to 52. You obviously, that means that's an average. So what happens is you have women that can go into menopause before 52 and women that are going to go into menopause after 52. So when is it considered abnormal? Well, there is a diagnosis called premature ovarian failure. That is if a woman goes into menopause before the age of 40. So technically, the medical system considers it to be normal menopause if it's 40 or above. Apparently, by research, about 5% of women will go into menopause between the ages of 40 and 45. So a majority of women will go through menopause past the age of 45. Maybe less than half of a percent to 1% will have what's called premature ovarian failure, and that is due to usually some sort of issue. Now, it could be genetic, but most of the time we see that with things like anorexia, severe autoimmune disease, chemotherapy, radiation, cancer, something super stressful to the body that it is going to basically permanently shut down the hormones for a woman. Number 3, what are the symptoms of menopause? Well, these are fairly easy to me and probably understandable to you, but we're looking at things like hot flashes, mood changes, depression, anxiety, insomnia, urinary incontinence or frequent UTIs, no bleeding, vaginal dryness, changes in libido. You can have a whole slew of problems, hair loss. There's all kinds of things that can be symptoms of menopause, and for every woman, it's different. Now, I will say, about 85% of women will eventually probably have a hot flash, and a hot flash has been described to me as a heat wave that starts in the core of the body and then spreads like throughout the extremities and face and hair. And even if you had not hair, scalp, sorry. Even if you had a fan on you, it wouldn't like cool you off. Like that's it. And it can be really disturbing. It can cause heart palpitations. It can cause anxiety attacks. Women will describe night sweats where you wake up and you're sweaty. That's probably a hot flash. And women that have insomnia, sometimes they're waking up because they're hot flashing when they're asleep. So how long does menopause last? This is a funny question. And what's funny is they give an answer that menopause can last for 4 years. Well, that's just stupid because you don't go through menopause. I think this is kind of hilarious. When you're in menopause, there is no post-menopause. You are always in menopause until you die. If you think about it, you don't get over menopause. You're always going to be in menopause. That's like saying you're over the age of 50. Well, you're always going to be over the age of 50. You're never not going to be over the age of 50 once you hit that mark. You're never going to be out of menopause. Now, you might have treated it and you don't feel the symptoms, or you might have gone through the menopause changes and gotten to the other side and just don't have the symptoms anymore, like my grandmother when she was 65. But she was still in menopause. So when these people diagnose it or they say, menopause lasts for 4 years, that's just stupid. What that means is that you probably have symptoms for 4 years. I have women ask me all the time because women are made to believe that they have to just gut it out. It's this whole concept that women should suffer. And it's really unfortunate. Women have been made to suffer since Eve ate the apple, if you're a Christian. Basically, since the dawn of man, women have been made to suffer and believe that they're supposed to suffer. What's fascinating to me is that we treat women like they should just have a little bit of discomfort. And women will ask me, because I'll help them feel better almost immediately with hormones. And they'll turn around at their 5-week follow-up and they'll say, well, how long can I take these hormones? Because they're already trying to plan ahead for when they should feel miserable again, because we as a society have made them feel like they can't have a long-lasting happiness. And I just tell women all the time, I've done this podcast. Go back and look. It's estradiol over the age of 65. Recent studies have come out that have shown that estradiol over the age of 55 or 65, excuse me, has decreased rates of colon, breast, and lung cancers, as well as decreased rates of dementia, and they live a longer, healthier life. So why do we need to stop? I talked to a lady this very day. We were talking about how an entire generation of women and doctors have been basically destroyed by the Women's Health Initiative and are so afraid of hormone replacement. And how can I expect women to not be afraid of estrogen when I have colleagues that are spreading misinformation on a daily basis, telling women that they can only be on it for 2 years, that it's dangerous, that the risks outweigh the benefits, and blah, blah, blah. It's totally ridiculous. It's misinformation. And in my opinion, it's kind of malpractice to spread these lies to women that they can't go on hormone replacement. It's really, really sad. But anyways, I digress. Question number 5 is kind of ties into the last one. Do menopause symptoms continue into post-menopause? I don't agree with the phrase post-menopause. I don't think it's a thing. I don't think you're ever post, meaning after menopause, because you're always in menopause. But some women will have a cessation of their symptoms, even if they don't treat anything. If they can gut through it, live through it, they might get through it in a couple, 3, 4 years, and then they don't have the issues anymore. So, it's just, the question being is, how much are you suffering and how much do you want to suffer? Because here's the thing. If you look at women now versus 30 years ago, way more productive, way more in the workforce, healthier, living longer. I mean, just look at how women dressed 30 years ago versus now, the body shapes, the way women look. I mean, it's amazing. There's that old adage, 50 is the new 30. And it's true in a sense, because we're living better and we have better things. And one of those things that we have that's better are hormones and hormone replacement. And we shouldn't be afraid to use it. So some women can get through menopause without using any sort of hormone replacement. And I was going to say medication, but I kind of want to get us past this concept of medication. While hormones are medicines that have to be prescribed, to me, we are replacing something that your body normally had. It's not like Excedrin or Motrin or Tylenol. You don't have those in your body on a routine basis, right? So that is a medication. Whereas these hormones are in your body for 40 years, and then all of a sudden they're gone and it doesn't feel good. So in my opinion, they're not really medicines. They are biologics that we are simply replacing to help you feel like you did and to prevent disease. So let's take a tiny little detour and talk about perimenopause real quick. Perimenopause, and I've said this also a million times, and I want to beat a dead horse because I really want to get this into women's heads. Perimenopause right now is being used as a marketing term. It's been a medical term forever, but it's not really a diagnosis, and that's why medicine really never talked about it, because it's not something that can be treated in a true sense. So just hear me out. Perimenopause is not a disease. It's not like arthritis where you have a disease process. It's a word. Perimenopause simply means around menopause. Peri is around, menopause is menopause, around the menopause. So I have women that will come in all the time and they'll say, hey, looking at my labs, am I perimenopausal? Well, if you're above the age of 35, you're perimenopausal because of just the definition. You're around menopause. There is no set definition. Some people will say 40, blah, blah. There's no real definition of perimenopause. Perimenopause simply means around menopause. And then I will combine that with symptoms. So are you having symptoms? Hot flashes, mood swings, irritability, insomnia, fatigue, decreased libido, decreased muscle density, osteopenia. There's a whole bevy of things that can be the perimenopause. Now, I want to treat those disease processes, but perimenopause is not something I can just magically treat. And that's why these supplements that are out there that are saying they're for perimenopause are a total joke, because you don't treat perimenopause, you treat the symptom that is coming from perimenopause. So let's just get that straight. Perimenopause is not a disease. It's a stage of life, just like menopause is not technically a disease. It's a stage of life, and it's completely natural. It sucks, but it's natural. So for those of you that want to be natural, that's menopause. Number 7. What are the symptoms of perimenopause? Well, I just kind of mentioned them, and actually, they're basically the same as menopause. You've got mood changes, maybe hot flashes, anxiety, depression, insomnia or restless sleep. You have brain fog. You can have more headaches or migraines if you're one of those type of folks. Hair pattern changes, breast tenderness, weight gain, especially around the trunk, vaginal dryness, painful sex. All kinds of things can happen in the perimenopause state. Number 8, can you still get pregnant in perimenopause or menopause? Well, menopause, no. If you are totally into menopause, even if you're 45, you're not going to get pregnant, because in menopause, you don't ovulate. Now, in perimenopause, because your ovaries are still working, you still may have a period. It may be irregular. It may not be every month. It could be every 2 to 3 months or 6 months. But because you ovulate, you could still get pregnant. Now, if you got pregnant, it's possible that you would have a miscarriage, especially in your mid 40s. I think the miscarriage rate is very high, like probably over 90% at that age, just because of the genetics being degraded at that age group, that you would have just an increased rate of miscarriage. But pregnancy is still possible. So I am not opposed, obviously, to birth control for women in their 40s. I am against birth control being used to treat symptoms of perimenopause, because that's not birth control, to me, is not really a great treatment plan, because what you're effectively doing with a birth control pill is you're shutting the ovaries completely down, and you're basically putting them into a fake menopause, because you're shutting the ovaries off, and then you're giving them these horrible progestins and fake estrogens that do have increased rates of blood clots, stroke, hypertension, breast cancer. Those are bad medications to me, unless you absolutely need them. And if we're just treating, especially in women who are, have a partner that has a vasectomy, or if a woman's gay and she does, not at risk for pregnancy, obviously, or she's had her tubes tied or an ablation or something along those lines, and the chances of her getting pregnant are 1 in 1,000 or slim to none, then there's absolutely no reason to be treating women in perimenopause with a birth control pill. And to me, I think it's a travesty that we would do that. Number 9. This is a really funny question, but I see it sometimes. Are there treatments from menopausal symptoms? Well, can we say hell yes? I mean, that's why we have hormones. Estradiol, progesterone, testosterone, DHEA, thyroid medications. This is why I wrote the book, The Hormone Balance Bible. Now, I will get shit from some of my colleagues sometimes because they say there's no such thing as hormone balance. Look, guys, it's just a word. Imbalance is a word. If the hormones were technically balanced, you would feel like $1 million. So when you have estrogen that's too high, or you have low progesterone or low testosterone, things just aren't in balance, right? That's why I called it that. My book goes through the 12 most common hormonal issues in women, from estrogen to testosterone, progesterone, cortisol, and thyroid. And then I have a couple of combinations of those as well. So there's 12. And then there are ways for relief. You can use hormones. You can exercise. You can eat right. You can use supplements. You can do spiritual practices. You can use energetic stuff like acupuncture and Chinese medicine. There's so many different things you can try. And in most cases, worst case scenario, they don't work, but that's okay. I mean, you can try whatever you want. Obviously, there are tons of hormone replacement therapy. There's different options for women. Most of the hormones on the market today, even through commercial pharmacies, CVS, Walgreens, Walmart, you can get bioidentical hormones. Micronized progesterone has been around for probably 2 decades. First came out as Prometrium. Now it's just generic progesterone. That's been around forever. There's 2 doses. There's 100 and 200 milligrams. Patches, the estrogen patches are now bioidentical. Estradiol. There is a patch called Combi Patch, which has estradiol and a progestin. I don't use that one because I don't like progestins. So I tend to stay away from Combi Patch, but I will use estradiol. There are also estradiol oral pills, though they have been around forever. It came out as Estrace. Now it's generic. The one caveat with oral estrogen is that it does have an increased risk of blood clots when taken orally. Topical estrogen won't do that. So women that have a risk factor for blood clotting, they've had a DVT, they have a family history of factor V latent deficiency or something along those lines, they can still use estrogen. They just should use topical estrogen versus oral. The other thing with oral estrogen is it will go first pass through the liver, as most hormones do, with the exception of testosterone, because testosterone is absorbed lymphatically, so it doesn't have the same issues orally. And then lastly, I wanted to just talk about what kind of research is being done. Well, we just talked about a few months ago about the study that was done on 10 million women that showed that there were decreased rates of breast, colon, and lung cancers, decreased rates of dementia. The Women's Health Initiative that came out 20 years ago, 18 years ago, was a horrendous destruction of education. It blasted the hormone replacement industry. I was practicing at the time it came out, and most patients went off of their hormones and were completely miserable. And it took the book Sexy Years by Suzanne Summers to start changing the dynamic around hormones, and she caught a lot of crap for it. But ultimately, I would say a majority of what she put in her book was correct. God bless her. I hope she's resting in peace. This was a woman who actually had been diagnosed with breast cancer and nobody would help her. And she went out on her own mission and actually kind of paved the way for many of us and for you all to be on hormone replacement now. So there are many studies out there being done. There was a study in 2022 that found women only account for 29 to 34% of early stage clinical trials. So still, we find men are the big subjects of most of the data. However, and it's really sad to say this, but because there is more awareness and now there's more money, I would not be surprised because of the number of women that are demanding hormones, that this will change. This dynamic is going to change. It's already changing. And I would keep asking questions. I would keep pushing. I would keep asking doctors. The more doctors get asked and the more that you leave because they are not providing you the healthcare that you want, they will start looking at things. They will start listening more. There was a legislative proposal introduced into the Congress this May by Democratic Senator Patty Murray of Washington and Republican Senator Lisa Murkowski of Alaska for $125 million of federal funding to be set aside for clinical trials for research on menopause. And I think that's amazing. I think the celebrities that are out there trying to drum up awareness is great. I just wish they wouldn't necessarily act like they have figured something out that the rest of us haven't known for hundreds of years because they've come up with some supplement that has helped everybody. Suffice it to say, menopause is pretty easy to deal with. for women that want to have help with it because your hormones aren't fluctuating. Now, I will still order labs on women because I want to see what their testosterone is. I know their estrogen and progesterone are 0, but I want to see what their thyroid's doing. I want to see what their testosterone is doing because as estrogen levels come back up, if you're going to replace estrogen, the testosterone numbers can go down. Free testosterone, free T3 for the thyroid can go down. They all work together. So I want to see where you're starting, and then I want to see where you're going with the therapy. Perimenopause is a little more difficult. The perimenopausal state is obviously in flux. So my colleagues will say to you, I don't test because the hormones are always changing. And my response to that is, any doctor that knows what they're doing, that understands hormones, that understands the menstrual cycle and where the hormones should be, can do hormone testing and should be able to understand the results. And when you hear a doctor say that to me, what that means to you is they just don't want to deal with it and they don't want to help you because they've got other things that they're dealing with. And, I'll probably get chastised for saying this, but when you think about it, if you have an OBGYN who is seeing 50 patients in a day, and I know this happens because I used to be one of them. I wasn't even considered busy and I'd see probably 38. But a busy OBGYN is going to see maybe 50 patients a day. Half of those, maybe 60% of those will be OB patients. The other half will be women that need issues, annual exams, ovarian cysts, whatever. If it's not going to be a surgery, fibroids, ovarian cysts, endometriosis, if it's not going to be a baby, it's a low dollar visit. A new patient, you might get $120. A return, you're going to get $50 or $60. Now, if I had a limited number of slots and I could put a $2,000 visit in there versus a $50 visit, it's human nature, right? So what they're going to do is they're going to say, oh, well, why don't you just go on a birth control pill? It's quick, it's easy, gets you out of the office. I don't do labs because if I did labs, I'd have to sit down with you and interpret the labs. And I know this because I have women. And the thing now that happens is you get the lab results sometimes before I do. And so women have looked at their labs. They've looked up their results. They've looked up on Google what, can happen, what it means. And so I have to do a lot of talking for these women. And if I was getting paid $50 a visit, I would probably go out of business because you can't keep the doors open. 50% of whatever we make usually goes to overhead. And so with malpractice and employees and rent and keeping the lights on and things like that. So it's really unfortunate. Women's health also, this is a really fascinating fact, and I'll end with this. If I know urologists. I know a lot of them. There are urologists that do men's surgery, and there's a urology group that does women's surgery. If they do men's surgery, they get paid more. They make more money than if they do women's surgery because women's health just simply doesn't pay well. Let me repeat that. Women's health doesn't pay well from insurance companies. And so you're paying the same premiums. Actually, women pay more premiums than a man because women have more problems, according to the insurance companies. And so women pay more. Fascinating that you pay more and that then they turn around and they pay the doctors less than they would pay for men's health. So you're getting screwed. The doctors are getting screwed. The hospitals are getting screwed. The insurance companies are the only ones that are making money in this deal. I got sidetracked. I didn't mean to do that. So I'm Shawn Tassone, America's Holistic Gynecologist. You can find me on Instagram at Shawn Tassone MD. I post there usually once or twice a day. I do a Q&A on Saturdays of Insta stories. So if you ever want to come over and follow me, I have a lot of answers on that page. I have a YouTube page that I'm on almost every day, talking about certain topics in the news and whatnot. So you can find me at Shawn Tassone MD on YouTube. And I have a book out that's been out for almost 3 years now called the Hormone Balance Bible. It talks about the 12 most common hormone imbalances in women and teaches you how to solve those problems on your own if you want to do that, or with the help of a doctor. I talk about all the different hormones, lab testing, what you should order, and things like that. I just wanted to close with, I hope y'all are doing well. If you need help, please feel free to reach out to me at my office. I'm in Austin, Texas. However, I am licensed in about 32 states, so I can see you via telehealth if you need help. Have a great day, and I'll talk to you next week.